Hello, good evening, everyone. Thank you very much for joining us. I'm Aditya. I'm a faculty member at Azim Premji University, and I will be facilitating today's panel discussion on health and climate change in India, current practice, and the path forward. This event is being organized as part of the Global Climate Change Week 2021. We are very glad to have with us two panelists who have several years of engaged experience in the development sector in India, including but not limited to addressing the health aspects of climate change. So, welcome Dr. Marcela D'Souza, Director of the Center for Resilience Studies at Watershed Organization Trust, and welcome Shweta Narayan, International Climate and Health Campaigner for Healthcare Without Harm. Thank you for agreeing to participate as panelists for today's event. Unfortunately, our third panelist, Shibaji Bose, is unable to join us because of an emergency that needed his attention. Marcela and Shweta continue to work on climate change and health in different geographies in India with various local and regional actors. So there is a lot to learn from them about what is happening on the ground, what is working, and what more needs to be done. It would be good to first get an understanding about the context from which each of the panelists are informing our discussion. And so I will first invite them to briefly share with us about their work and their organization. And after that, we can get into a more conversational mode where we talk about health and climate change in India. So I first request Marcela to please tell us about her work. She will be sharing a few slides, I think.
Hello, good afternoon, everyone. And thank you for giving me this opportunity to share our experiences, and mainly because it is an issue of concern that we can talk about. I would like to share about the work that we are doing in Watershed Organization Trust. And as you know, the name says, we talk mainly about uh, natural resources regeneration. And this is an area, what we see, when natural resources are degraded, it is aggravated by climate change. And this, in turn, affects food and nutrition security, causing undernutrition. At the same time, it increases droughts, water scarcity, insufficient and poor quality water, and at the same time, floods, which again aggravate agriculture productivity. So it is a whole,
Marcela?
yeah.
Would you make it into slide share mode so that it will be clearer and fully visible?
Is it better?
Yes. Yes,
Okay,
thank you.
thanks so much. And the second aspect, what we have begun to realize is the rising temperature, the prolonged summers, its impact again on agriculture, but also its impact on human health. We all know the situation in rural India, particularly in the dry lands, so I won't go more into it. The number of our people who are dependent on livelihoods in these degraded conditions, who barely earn, and what we realize, the root cause of poverty, and we see that a lot coming out in a lot of data these days, is the degraded ecosystem, causing low agriculture productivity. More and more of our rural communities and households are dependent on agriculture, and this whole context is aggravated by climate change. It impacts agriculture. The droughts and floods impact the pest attacks. It impacts heat and human health. This is the context that all of us would have seen as we travel across the countryside, particularly when we travel by flight. It is these degraded lands that are supposed to provide water and livelihoods for rural communities. And my organization works in 7 states. We had an impact in 9 states, reaching out to over 3,700 communities and have reached 1.43 million hectares of land, which we have worked towards regeneration. We have now started taking land management from an ecosystem perspective because we realize that land and water management is very crucial in order to give us our ecosystem services, increase productivity of agriculture, food, fiber, water, etc. It provides livelihoods. It also provides us with health and nutrition, drinking water and sanitation, and it can lead to empowering communities. So our response is empowering communities, enhancing them, increasing their resilience to climate change by rejuvenating the landscapes, improving agriculture productivity, providing livelihoods, increasing water availability, empowering communities, marginalized communities, and the local communities as a whole, and strengthening health and well-being. The areas of our implementation are three areas of action. One is on implementation, action on the ground. We look at research, applied research for policy advocacy, and research with science to guide implementation. And this is then disseminated through capacity building and trainings. So we have the Center for Resilience Studies, and I'm the director of this. We have an interdisciplinary team that brings different groups of science to talk to one another, because we realize in this whole approach cannot be addressed in isolation. We cannot just look at nutrition and the malnutrition status that our country faces only from the provisioning of food without addressing agriculture, without addressing the empowerment and capacity building, without addressing the water, and without addressing ecosystem services and the ecosystems. So that is the integrated approach we look at. And this is what we would do to address food and nutrition security, converting degraded lands with people's participation into green lands. You can see it over here, the different types of measures where communities are mobilized together, harvest water, have more drinking water, provide food and agriculture food security. Even during the COVID times, we worked very closely with the communities. When they struggled to get pesticides, for which we were very happy about, we shifted them to more organic formulations so that we can then conserve more and more the ecosystems, bringing women and men together, using more and more organic formulations, and having automated weather stations located in the village so that these can provide weather advisories to farmers, and we provide these advisories on a farm-based level. But more important, we realized we needed to move into agro biodiversity. We have lost a lot of our agro biodiversity. And we looked at mobilizing communities and households to actually plan agro biodiversity for food security. And people want it for their food security, while they can promote the rest of their agriculture for farming. So what we did was, we have a little study that is going on where we are mobilizing communities to go back and look at the indigenous varieties and promote them. People are more familiar with it, they like it. And this is a study that is going on in something like 30 or 40 villages in different areas. And through this mobilization, we realize that farmers and people want their indigenous varieties. But together with this, what we also do is promote multi-layer farming for food security. So it's not only the crops, the cereal crops for the market and for home consumption, but promoting multi-layer farming, kitchen gardens, and then teaching the community, the women particularly, how to use the local varieties of foods to provide a nutritious diet for the people. This whole thing is then linked with the weighing of children, which we do together with the Anganwadi workers. And at the same time, these are the weighing taking place by the village women and the health promoters together with the Anganwadi and the Asha workers. So we combine the two so that it continues. And this helps the communities to take it forward. We also do the hemoglobin testing, and women can talk about now how their nutrition is improved despite having lower productivity sometimes with agriculture. But when we have climate resilient agriculture, it then enhances the ability of their lands to be more productive. Thank you.
Thanks so much, Marcella. The wide scope of work that is done by Watershed Organization Trust is very difficult to summarize in a few minutes, but thank you so much for giving us this input. The idea of ecosystems based adaptation at the center, empowering communities, the interesting technological interventions such as agri-med stations, and also the agriculture nutrition linkage, which has all been strong part of your work. We'll definitely explore this, and also the heat and other issues that we have been working on as we move along in this conversation. Before that, I will request Shweta to briefly tell us about her work, and then once we have understood the context, I think we can really move forward with our discussion. So, Shweta, shall I share?
Yes, please. Yes, please.
Yes. Yes, Shweta.
So, as I was mentioning that, as Aditya mentioned that I'm a campaigner with Healthcare Without Harm. I'm a campaigner on climate and health. I also wanted to kind of do a brief introduction of the organization and what we work, so that there's a clearer perspective of where my conversation on climate and health is coming from. I'm also sort of, given that this is just before COP26, so I'm also kind of giving you a sense of what the health sector is engaged in doing as a pathway towards COP26 and future. So quickly, Healthcare Without Harm is a non-profit. It's a global organization, and it is the idea behind the organization is to work with the health sector to reduce the sector's own ecological and environmental footprint, but also use the sector's credibility and its resources and its influence to a larger policy change towards sustainability and with equity and justice at the center of it. So those are the twofold missions of the organization. Next slide, please. We have offices in US and Canada, Europe, and Asia. We also have partners around the world in every continent that we work with on climate and health related issues. One of our flagship project is the Global Green and Healthy Hospital, and that's a network of hospitals in 74 countries, about 44,000 hospitals, and these are hospitals that are working at their hospital level and collectively at a regional level in sort of advancing the mission of reduced environmental footprint, more sustainable healthcare, and through that, again, showing leadership in policy transformation towards sustainability. Now, why health sector? I think is a very good question. And to that, my answer is that while a health sector and health professionals are trusted leaders, they are trusted messengers. Everybody sort of in times of sickness reaches out to their healthcare providers and trust them in the methods of healing. But the sector itself, and next slide, please. And this was an assessment that we did in 2019. We realized that the sector itself is has a huge climate footprint. It contributes to nearly 4.4% of the net global greenhouse gas emissions, and it's growing as the healthcare demand is growing. And there is merit in leading by example. So while we're talking about climate resilience, while we're talking about reducing overall emissions, we have to be cognizant of the fact that if the health sector were a country, it would be the 5th largest emitter, and something needs to be done at the sectoral level. And that sort of also segues into sector's own method of leading by example. So sector itself reduces its own carbon footprint and shows that this is possible, reduction is possible, and influences other policies. So very quickly, next slide. This year, and this was the footprinting exercise was done in 2019, and this year we have come up with a global roadmap that we have identified. And if you just click on the slide, Aditya, the key points of what we have identified in terms of and especially in the backdrop of the COVID-19 crisis, which is an indication of what has happened in the last 2 years and what kind of health crisis we have faced together. How do we move towards sustainability, keeping in mind that as we are recovering from COVID, and if we don't want the climate crisis to affect us, we have to build in resilience and sustainability. And we have also come up with, we can breeze through some of the slides in the next few minutes. We have come up with tools and capacity building methods and how the sector itself can measure its emissions, create a baseline, and then then be able to find out measures to reduce emissions. Sorry, Aditya, next couple of slides, we can just breeze through it. In context of, next slide, please. In context of the upcoming COP26, the Healthcare Without Harm was an official health partner of United Nations Climate Change Champions Race to Zero program. And so far, in fact, Monday is going to be the next, the overall year's announcement. But so far, we have 40 healthcare institutions that represent the interest of about 3,000 hospitals in 18 countries who have committed to Race to Zero, which is reducing their emissions and achieving net zero by 2050. And then there is also another initiative that is sort of taking shape, and announcements will happen at the COP itself. And that's in the next slide, where the UK COP presidency, the World Health Organization, and Healthcare Without Harm have come together to encourage nations to make commitments on climate resilient and sustainable healthcare, which looks at building the resilient health systems to cope with the climate crisis, and at the same time building low carbon health systems. So these are your anchors at time of crisis. And my last last slide is about so what we have seen so far is making the health system robust and reduce its own carbon footprint and become resilient. We are also at the same time, so that's all sort of internally looking at the sector, but we are also working with the sector in sort of being the advocates for larger policy change, and that we are working with the health professionals themselves, so the doctors, the nurses, the community health workers, in sort of making their voice matter and taking their trust in the, building on the trust that we have on their leadership to advocate for better policies for other sectors. So we have, just as an example, we have Doctors for Clean Air and Climate Action in India, which is mobilizing thousands of doctors across the country on air pollution and health. And what could be a low carbon or low emissions policies. So just to give you an example of that. So these are like two big pillars of our work, and I would like to sort of stop here. Just I think this would be a good context to talk further.
All right. Thank you so much, Shweta, for that very nice summary of the work that Healthcare Without Harm is doing. And you mentioned about healthcare workers being trusted. I think that's an important point, and probably will come up later in the discussion when I bring up COVID and how it has affected this whole idea about climate change and health. You spoke about three issues of resilience, that is health system resilience, low carbon health systems, and advocacy by health workers. So very interesting points, and I think we can discuss more of this as we move along in the conversation now. So let's speak about health and climate change. So Marcella, many people will not know that you're a medical doctor, you're a physician, because you work for several years now in agriculture and ecosystems, and you speak the language of ecosystems wherever you go. But you even practiced as a physician for several years in remote and resource poor settings. How has your medical background and a health lens, we can say a health lens, how has it informed your work in the development sector and specifically for your projects on climate change and health?
Yes, I think it's a very relevant question. my whole experience when I moved, when I, after a few years of working in a hospital, I had an opportunity to work on the Andes. And it was on the Andes in very remote areas that I had to, where there were no doctors in many, many villages, that I had to reach health to these people. I had to reach medicine to these people. I had to be a doctor in all these places, and I couldn't clone myself. It was a time when we had the Sendero Luminoso very active at that time in Peru. And that was the time I realized, and I also have to say that Peru had a very strong community health system from those days. So I had the opportunity of getting integrated into the system and working and realizing that health cannot stay alone, but it needs to work together with the other aspects. You know, we had agriculture, we had people working in community health and livestock, etc., all working together as a team. When I returned to India, I thought this was what we needed. So that was where I realized that when I got into the opportunity of working in community health, working in Watershed Organization Trust to promote women's health, it was the women who asked me, what do I do to feed my child? How can I improve the health of my child? I grasped that request and I said, if people want it, we need to integrate it. I have to say that I cannot help it and I do not want to help it. I still am a physician, always looking out to see either how we can help uh, families be whole, live healthily, families and communities, as also promoting this in our villages. So for us during the COVID times, we took the opportunity of having online sessions and training our people in all the remote areas about the COVID, what action to take, what precautions to take, how do we need to do it. So, you know, I have to say that I will not give up being a physician, even in this situation. You know, so it gets very integrated and people are quite used to it. Villagers are quite used to it. The same thing happens with the water. Looking at
Yeah.
water purification, looking at clean water, looking at the health of the ecosystem. Because if we don't look at the ecosystem health, we are not going to be healthy no matter what we say. So that's the way I look at the integration and being still a physician.
That's great. Specifically, if I were to ask you follow-up questions related to your work on health vulnerability, on vulnerability assessment, and also your work on heat stress in rural areas, what was it that made you feel that these are things that we need to work on? What was the motivating factor there? And
Okay. Uh, you know, as we were observing whatever was happening in the right from 2000, we started observing a change in weather patterns. And I come from Nagpur. I know it's extremely hot in that area. So 2000 to 2004, we had years of drought or drought like conditions in the areas which we had not seen before. That was the time we realized something was happening with the weather and we needed to address it. However, when we started looking at the weather, we realized we needed to understand better how do people experience the vulnerability. That was the reason why we started our research unit, applied research unit, to go out and understand what's happening. We developed a mechanism, a methodology to see what's happening. And in the process, what we realized that we were getting heat stroke experiences, not just in the Vidarbha area, but also in the Marathwada area. That was the time it struck us. We need to see what's happening with the heat. I have to say that, you know, as a part of the work in the summer season, we would tell the people, you know, you work in the early morning in the land. They had to do watershed work. They were given work in the land. So people could earn doing it. They would go early in the morning from about 4 to 5 in the morning till 8. And then again, then they would return home. And then again from 4 or 5 in the evening to 8 at night because it was bright. During those the midday hours they were at home. Once we went to the village, and then we realized in the midday hours they were staying in in houses with tin roofs, and it was extremely hot. That was the time we realized, we said, are we giving the right advice? Do we know exactly what is happening? That led us to take up the study on heat and heat stress in the areas, and also see what is happening to the degraded landscape, the cutting of the trees, and the increasing temperatures in rural areas. Heat stress is being studied a lot in urban areas, but in the concrete jungles. But in the rural areas, with the degradation and the tree cutting and the very severe temperatures, and then we tell people you go and stay in your homes. They couldn't. We couldn't. We started putting data loggers in all these houses, and we found the temperature under the tin roof in the middle of the day would reach about 52 degrees. And these were data loggers we had put in villages. So that gave us an indication that it's if we have to address heat and human health, we cannot just say the temperature is high, you go and drink water, you need to take salt, etc., etc. We had to look at what's happening to the housing system. We had the Indira Awas Yojana, which was promoting the metal roofs. It is easier, but is that sufficient? What happens to them? The second aspect, what we found was the summers are becoming longer. So, with the extended summers and the higher temperatures, that has a lot of exposure for the people. The type of working hours that the people have when they have to go out into the markets, you know, all that time was so stressful. That's where we started working on how do we address the heat stress of people. It has now led us to prepare heat stress advisories, because we get weather station data even from the IMD. We do get the temperature data and the forecast from IMD, because we provide agrimet advisories. To that, we are now linking in the summer heat advisories, telling people for the respective areas when do they need to go out, what do they need to do, how can we prevent, and also reaching out to the uh, health sector to be able to address it. Sorry. I'm sorry. I hope I
No, no.
addressed it.
No, 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 no. Thanks so much, Marcella. And very interesting to hear about the motivations behind some of this work and the systematic documentation and reflection that is happening in the context of your project areas based on what people are experiencing locally, and to follow it up with this sort of rigorous work to document issues, to identify these policy interventions which might be leading to maladaptations. The fact that farmers, agricultural workforce, which is forming the major share of India's population, are in a situation where they are exposed to heat outdoors and also indoors when they come into their house to rest. I think these are definitely very critical concerns, and very nice to hear about some of this work. And we will explore a little bit more about how the IMD and the other actors are coming into this picture as we move along. Shweta, so I've also known you from the mid 2000s, and as an environmental activist, a scholar activist who has been engaging with communities affected by industrial pollution, and now as a campaigner for climate and health. How has health informed your work in the context of the environmental issues and the community issues that you've been looking at? And how does it now, in your new role, in your transformed role, where you're specifically focusing on climate and health, how has this informed your work?
So I think, health is core to whatever we do. I mean, as an environmental advocate or talking about climate and health, because it's the most in every sense, from community's perspective or from from any perspective, it's the most measurable sort of and most immediate concern for people. Measurable in the sense that if you want to measure the success of any of your policies, if it benefits health, then it sort of is a very good metric for um, uh, gauging the success of the policies. If it does not benefit health, then policy needs tweaking. Immediate need from communities' perspective, be it communities living in pollution impacted zones or in any part of the world where, because climate crisis touches every part of the world, um, the deteriorating air quality, the deteriorating water quality, the scarcity in food, social security, or even shelter, for that matter. All of it is affected by climate crisis, and all of it is sort of measurable in terms of your health indicators. So I think health is key, and that's why I think it's important that health becomes the fundamental foundation on which policies are designed, incorporating the health benefits of that policy or health impacts of the policy. So even when you look at pollution impacted communities who are fighting for a clean environment, I mean, their demands are like, there could be different campaigns in different parts of the world, but the demands are common. It's clean air, clean water, right to a healthy environment. So again, just to sort of reiterate that health is sort of fundamental, though it's not spoken as much as we would want. I mean, at least personally, I would want to see health sort of in all the framing. It's not happening right now, but it's a basic assumption, and the need is right now that we articulate it more strongly from the health lens, because it's so important. Because sometimes when you don't mention it, it sort of becomes it goes into the background, and it's not really given that the amount of importance that it needs to be given. So for pollution impacted communities around the country, while the anecdotal experience of health impacts has been major, unfortunately we have not seen the number of health experts or advocates who have that expertise to come forward. I mean, we have very few, and Aditya, you've been involved in this, and that's been a major blessing for us to have a health voice sort of articulate what communities have been saying, because it's a matter of, it's not just validation, but it's also bringing in the expertise as such, and sort of framing it in a manner that makes sense to the policymakers, because you're not just sharing your lived experience. There's somebody who's validating it, somebody who's an expert who is validating it. So I think from that perspective, and as I mentioned, that as an environmental advocate, we always found health as a missing link. We had for all the projects, we had engineers, we had community members, we had courts, we had judges, lawyers, sort of commenting on any project, but we never had doctors specifically or health professionals specifically looking at the health impacts. I mean, in our Indian policy making space, we have environmental impact assessment, which technically should have included health. There is theoretically some inclusion, but it's not really as much as to influence the decision for the projects. And so we don't have any health impact assessment. So a lot of our work in sort of even around climate crisis is sort of highlighting that climate crisis is a health crisis, and they're not two different picture. Here, this one common picture. And if we look at building resilience, building policies from a health lens, we are also sort of contributing in climate action. So, many decisions about controlling air pollution is also, beneficial for the climate. So just like, to put it that way. Yeah, I think, just to answer your question in short then, is that health is absolutely critical, and it's a very important lens in order to sort of think about climate and environmental impacts from that this thing. So in my new position, I mean, I get to highlight more of health impacts. So yeah.
All right. Yeah, I think now you're almost exclusively speaking with people within the health system, from what I understand. But yes, I'm very interested to hear a little bit more about it as we start moving. I mean, as we move on and discuss a little bit more about the actors that you're engaging with. But thank you. I mean, it's a very interesting point that health should somehow be a very critical value and a critical focus when we are talking about pollution or climate change. And the fact that the health workforce at this point in time is not yet equipped to be advocates for this, and some of the work that you're doing is related to that. Definitely interested to hear a little bit more about that as we move along. So at this stage, I think it may be worthwhile to now start, because we say climate change and health, and we see that when we talk about climate change and health, Masala has brought in the issue of agriculture, livelihoods, and it's such a broad canvas. Shweta has mentioned about air pollution, and when we start looking at air pollution, it's like the sectoral scope is so huge. So let's look at the actors that each of you have been able to engage with in the context of climate change and health, and what your experience has been. So, Marcella, specifically, if I remember, in the context of vulnerability assessment, you had, I think there was an engagement with the Andhra government, if I'm not mistaken. And in the context of heat stress and the need for these heat advisories, there was also some local level dialogue with policymakers. But of course, you're engaging with a range of other actors as well. Can you tell us a little bit more about your experiences of bringing in this health angle and the vulnerability angle while engaging with the various actors?
With regard to the health aspect, uh, we are, when it comes to the heat stress, we did do a lot of interaction with the medical fraternity, particularly in the Vidarbha area, and because that's the area which gets extremely hot in summer, and with the rural doctors, because with them we had to understand what was happening. So it was on the one hand with the doctors in that area, as also with the other health workers in the area, in the villages and others. So that was one group with whom we interacted very closely, and also shared with them the type of health advisories we had to give out. We learned from them. We spent a lot of time in interacting with them and with the people living in the area. So that was one group. I have to say it was not officially at a higher level, but rather more local, because at this stage we had to understand it better. Coming to the health advisories just now, what we have taken forward, because we are working closely with the providing agromet advisories to farmers, in the different locales, and working very closely with the IMD and with the other departments in the agriculture sector. Over here, we also linked up the heat advisories, since we get it together the with the from our stations which we sent out. So this is the time when, at the moment, we are having the heat advisories assessed by some of the medical practitioners who are active in it, and then we are just providing it through our own outreach outposts, and our system at the moment. Once we have got more confidence in terms of how people respond, etc., then we will take it to a higher level, where we will promote it to other through the agriculture department, because that is a department that actually uses the agrimet advisories. So it's a very good combination that it goes out to the people in the rural areas who need it. So these are the two, this would be the groups that we are working in. When it comes to nutrition and the other side, we have been working very closely always with the Anganwadi, with the healthcare workers, with the ASHA workers at that level, because we want the system to be integrated and taken forward beyond our role in the villages, and so that the villagers can continue their interaction with them. So that is the other system that we do follow. The rest of the other interactions is mainly with the other departments that we work in, with the rural development, with agriculture, with the water sector, looking at water quality. When it comes to looking at the science of it, we then have integrated with a lot of the other with other scientists to share how agriculture pollution and other pollution is actually contaminating water quality and aggravating the situation of human health. So these are the interlinkages. we try our best to see how we can bring the backward and forward linkages, including health, to the different departments. Because we should not be working in silos. We have to look at it more systemically. And this is what we try to do in bringing the other groups together.
Thank you. Definitely, this is, the range of actors is so broad. And I'm very interested to see how all of this was received. This was all at some level, water was anchoring some of this. And we can see that you've engaged initially with the medical practitioners and the village level health workers in the context of heat. Was it already perceived that this is an issue, that this is a priority that they need to engage with, and on the other side, when you're engaging with the agri sector, when you're engaging with IMD, have they what has been the experience in that context? On are they receptive to this idea of health needing to be something of a focus when addressing issues locally?
Uh, I have to say, we have not overtly, aggressively looked at it, promoting the health aspects, with the IMD and the others. But what
Yes.
we have started doing is, because, all the departments are working in silos, even within a ministry, you have each department, having different programs, and they barely talk to one another. So thank God now, at least with the Jal Shakti ministry, the waterways are coming together, for example. But what we have started doing is focusing on ecosystems health. And we have started our whole, we have changed our logo. Aditya, you would have noticed that the logo has changed. We have moved from just doing isolated activities, focusing on water and agriculture, etc., but looking at it from an ecosystems perspective, because that is where we start seeing what is the interaction. What happens when our forests are degraded and we have lost our forests? That is where the health aspect comes in. Talking about COVID, talking about the viruses and the other diseases are coming because we have lost our forests. This is an aspect not yet sufficiently observed. Talking about air pollution and Delhi and the burning of the agriculture. There's this whole interlinkage. This is where we started our whole approach on bringing the different departments together to look at the backward forward linkages, to look at it from a systemic perspective, and know that we can only take it forward and protect the health of our ecosystems and therefore human health if we protect our ecosystems, the water ecosystem, the water quality, what happens. It's the whole system that is integrated. So that is the type of approach. And into that, we start bringing in the different, conversing with the different ministries and departments.
But so far, you have felt that it has been an encouraging sort of a situation in the context of the interventions you're thinking about and
Yeah.
you have implemented in the context of
In
health and
terms
planet.
of ecosystems, uh, in the terms of ecosystems restoration, we are lucky in that sense, a little late, but we are catching on to this tagline of the UN ecosystem, the decade of ecosystem restoration, the decade of action to meet our SDGs. And that's where we are looking at the integrated ecosystem approach to take us forward. And incidentally, just to share, we are soon launching in a couple of weeks' time, launching a collaborative for ecosystems based adaptation for resilient incomes. So, bringing it in together with incomes, because in this collaborative, we are looking at inviting scientists, practitioners, policymakers, donors, everybody to come in and pool in resources to see how we can respond better, to the various aspects. We cannot talk only of human health without talking of the health of biodiversity, without talking of the health of our ecosystems, of our water quality, if we have to survive in the next 10 to 15 to 30 years.
Yes. That's a quite a short timeline over there. But yeah, I think that's the kind of world we are living in right now. Thank you so much, Marcella. Moving on in this conversation about actors, Shweta, over the last few years, you have been engaging quite actively with health systems, health workers in the context of climate change and health. Uh, how has this experience been? Has this idea that health systems needs to be concerned about climate change, has it been received well? How has it been received, and what have you felt interacting with various health system actors?
So that's very interesting that you asked this question, because before we even started thinking about some kind of a climate and health intervention, we last year, actually in the midst of the first COVID wave, we did actually survey among the health professionals in India. And we looked at like seven streams of health professionals. So we looked at doctors, nurses, medical students, frontline health workers, community health workers, paramedical staff. And we surveyed about 3,062 health professionals from all over India, six representative states. So that covered north, south, east, west, and center. And we asked them about, the survey was about their knowledge, attitude, and practice on climate change. And we asked them about just basic understanding of climate change to what they feel their role is. Like, it was a extensive sort of investigation. And the results were surprising and not surprising at the same time. And Aditya, you've been an advisor to that program. So, but just to just think what the results were, there is a very high amount of um, under like the knowledge of climate change, the word climate change and what it means, is very high among the health professionals, and no doubt about it. It's a daily conversation now. We see different crises happening at different times, so it's quite obvious that people know about the word climate change. What was interesting among the health professionals was some of the impacts of climate change on health was more, they knew more about it than some of the other impacts, like air pollution. It's visceral. It's media talks about it now. Now is the pollution season, Diwali, and the farmers crop burning, and this sort of continues. So people knew more about, the health professionals knew more about air pollution, as opposed to malnutrition as a result of climate change, or as opposed to social conflicts or migration as a result of climate change, because these are more long drawn out processes. So there was a clear difference in their perception on that. What was also interesting is that while they talked so much about interventions, in terms of some of the legal tools or negotiation tools that are there on climate, like the Paris Agreement, or other protocols that are there, there's not much awareness about the international protocols. But when it comes to national protocols, like the National Action Plan on Climate Change and Human Health, which Ministry of Health and Family Welfare sort of leads, they knew about that, but then you didn't know much about the Paris Agreement. So we understood sort of some of the gaps. The most exciting part for me in this survey was that majority, I would say 80% plus, health professionals felt that they had a responsibility to act, to protect their patients, to protect their communities. So they felt they had a role and responsibility in climate action, in advocating for better policies, which was super exciting. And given that this was in a COVID context, so we also talked about that, what would COVID recovery look like for you? And interestingly, they said environmental protection in sort of a priority thing, economic development, and then everything else. So even and it goes to what Marcella has been saying, that planetary health and human health are deeply interconnected, and health professionals at some point understand that. I mean, what we understood in terms of one requirement from this exercise was that they understood, the health professional community understands the impact of climate change. They were asking for more tools to be able to do something from, like, individually and their systems. We know about climate change. What do we do? We know about heat stress. What do we do? So I think the gap was what we understood from this exercise was that the demand for actionable items where they could contribute in climate action. And that was a very good point of starting, because we understood that we don't have to spend more time in raising awareness, because the awareness is already there. We have to equip our health professionals and how do they act and improve community health and public health. So that was an interesting exercise, and in terms of actors that we work with, on in addition to that, we also work with sort of advising health departments in different states on just awareness building on pollution, on climate and health, or on framing their state action plans on climate change and human health, which is now as I said, is led by the under the National Program on Climate Change and Human Health, and focusing on specific actionable items where state can strengthen its capacity and intervention in order to make the state health systems more resilient. Because our belief is that in an event of an adverse climatic incident, health and health systems should be the last facilities and buildings standing, because they have a double role, like what we have seen in COVID. It's the burden is on the health system, and health system need to be prepared. Unfortunately, this is something we had previous to this survey. We had also looked at 2018 floods in Kerala and looked at the response of the health systems. And one thing that was very interestingly brought to me, which sort of stays with me, apart from, I mean, the Kerala health systems are far more resilient and did very well, but there were impacts. Nonetheless, there were impacts in terms of water flooding, in terms of destruction of resources, medicines, vaccines, and all of that. But when we were interviewing a range of health professionals and their views on why this crisis happened, and there was very interesting perspective that we got throughout, that which was that people come to health systems when there is a crisis, but if you come to health systems early, there wouldn't be a crisis. And I think that's a very important lesson, and what we heard, and we need to sort of advance our work in sort of implementing that we avert a crisis by including health in advance, rather than reach out to health professional and health sector when there is a crisis.
So thank you, Shweta. Definitely some very interesting perspectives there, and nice to see the enthusiasm of various health workers. Was this across the spectrum that they were interested to learn about climate change and advocate in the context of climate change? Was
Yes.
it
Yes.
doctors?
Yes.
Who was it?
No, it was doctors, nurses, medical students, paramedical staff, community health workers, NGO health workers. So we looked at like a good spectrum of what we could understand as people who have a role to play. We saw a lot of enthusiasm from medical students themselves, which is fantastic, because they are the future health professionals and actors and leaders. So there was a lot of interest in and specific topics. Like one thing that we seen, which corroborates what's happening elsewhere. Young people are interested in to understand about climate crisis. Young people want to intervene on actions. Young people are most affected. I mean, the issue of mental health, which was highlighted. So as a result of this, just to sort of also mention this, as a result of this exercise, we put together a guidance document on climate and health for health professionals. And this document is available in English, Hindi, and Malayalam. Malayalam, I think, would be released soon, but at this point, it's available in English and Hindi. And we have realized, I mean, in fact, one chapter to this guidance document on mental health, climate crisis and mental health, was added by Medical Students Association of India, who participated in this process and developing this module. And they felt that it was a very important issue. And I mean, obviously, mental health gets affected, and young people, after all the news that is there and all the modeling and the scientific information that is there, it does overwhelm you. It does affect you in terms of when you think about your future. So I think across the spectrum, and it's interesting because a lot of it is experience, like especially with doctors. I mean, with medical students, like a lot of things that they see and read, and with generally in the health professional, it's also first-hand experience because they're treating their patients. So community health workers are seeing what's happening in the villages. So it's more than just what you theoretically learn. Doctors and nurses are treating people who are suffering from certain diseases, which can be connected back to air pollution or direct impacts of climate change. So there's a lot of like personal experience, and then there is this on top of it, all the tools and methods that you have to advance conversation.
Yeah, thanks so much, Shweta. For sure, especially one of the last points that you mentioned in the context of young people experiencing climate anxiety. I think there was a global survey that was done recently that shows that this is definitely a thing, including in places like India. So a large majority of the young population are experiencing these kinds of concerns and are anxious about what kind of action that needs to be done.
Hmm.
So it's very interesting that you have developed these specific advisories and specific guidance documents for health workers to be able to do something, to not feel helpless, but see these points and get moving with action. So that's really really nice to hear. And in that context, I think both of you had also brought up this COVID, having somewhat thrown a spanner into the works, we can say. And so, how has COVID, you feel, affected? In general, we know that COVID has somehow made everybody a little bit more attuned, aware about health in general. So, there's the conversation of health has become universal now. Everybody is talking a little bit more about health because of COVID. Not everybody feels that this is actually uh, this is actually a wake up call. Some people feel that this is actually pushing health in some opposite direction as well, or the focus on health, in some international context. What do you feel based on your own experiences? How has COVID now, or how is COVID now informing your own work on climate and health, for instance?
Who do you want to
Marcela?
go first?
Okay.
Okay, maybe
Um,
Shweta first, because Marcela has
Shweta
always
goes.
been
Yeah.
going first. Shweta, surely.
Um, okay, so I think you are right that with the COVID crisis, health has sort of, in some way, come to the forefront of conversation. But what has also come to the forefront in the conversation is the inadequacies or the lack of preparedness in the health sector itself in dealing with epidemic or pandemic at this scale. And what bothers me the most, and I think a lot of us are worried about it, that this is nothing in terms of what is predicted in terms of what climate crisis can bring to us. So it is worrisome. Climate crisis will pale COVID crisis if you compare. So it's a good thing and a bad thing. Good thing in the sense that it has actually shown us our lack of preparedness and should be a wake up call for the systems to be prepared, for communities to be prepared. And bad thing in the sense that what I see in terms of recovery plans, if you see, we're going back to business as usual. We're going back to all those ways. And again, I want to reflect on the planetary health and human health connection, because COVID is an example of the broken relationship that we have with nature. And what led to COVID should not be repeated as we recover from COVID. But if you look at the recovery plans of nations all across the world, we are continuing with our addiction to fossil fuels. We are continuing with cutting down further forests and logging. We are continuing with all those policy framework and planning and all those decisions that actually caused this crisis in the first place. So that is going to that is my two bits. And I think the emphasis, one lesson that if we have to take for the health sector, is that we need to be better prepared. We need to be resilient, and our health systems have to be the anchors for communities. And we have seen that if health system collapses, communities collapse.
Yes, uh, definitely. I think, yeah, you can see COVID has somehow become some sort of a contentious point for how development should be looked at, and uh, the build back better is not something that we are universally seeing, unfortunately. um, Livelihoods and economy, people are looking at it at a certain way, and I think this is unfortunately not the kind of lesson that COVID should have taught us, at some level. And so, in that context, Shweta, to follow up, now with COP26 coming up, and from what I understand, health is one of the central themes that is actually going to be the focus of this particular conference of parties. Uh, do you feel that health has now has the voice to actually, show that there is a need for this focus on health when we take future actions, whether in the context of mitigation or adaptation? What do you feel is the situation right now?
Well, see, the sector is appealing. I mean, and just an example of that, what health sector has been telling the leadership. We have about 45 million health professionals from around the world who have signed on to a letter urging the health leadership and urging the leaderships at COP26 to act on action, or to make decisions that are healthy for the climate and healthy for the people. So, I mean, this is unprecedented. 45 million health professionals from around the world have signed on to this letter. And some of the demands of the letter is, very clear. I mean, and this is just sort of further advancing what science has already told us. This is further
Yes.
telling us that we cannot continue, I mean, build back better, as you said, we cannot continue with business as usual. We cannot continue our addiction to fossil fuels. We cannot fund polluting projects. We need to have a sustainable, low carbon, and resilient health system. So, I mean, there's nothing new that we are saying, and the sector is sort of like, it's close to screaming at the top of its voice, saying that, learn something from COVID. The test would be how much of our leadership globally is willing to learn something really, and sort of invest in policies that protect both planetary and human health. But yes, health, and just because of also in context of COVID and what we have seen throughout this year in terms of climate disasters, and I think one thing that we have now, it's clear that these climate disasters are not just going to be in one particular geography. It's all over the world. I mean, from wildfires to floods in Germany to now what we are experiencing in Kerala and Uttarakhand in India. It's just a grim reminder that all of us will be affected sooner or later. So it's a further reminder to our policymakers and our decision makers that we need to act now, and we need to invest in policies. This thing. So I'm really hopeful that the health messaging would be seriously taken, and this is not rhetoric. These are facts, and incorporated in this thing. So let's hope that health takes a center stage. We also have, just to add to this, yesterday I was at this event. We have doctors from various hospitals in UK, led by the Great Ormond Street Children's Hospital, cycling from London to Glasgow with the message of, and this letter, they are taking this letter and a whole bunch of messages on for climate leadership to act. And they're sort of literally leading by examples. So, yeah.
Thank you. Very nice to hear about the positive thoughts that you have in the context of the health sector and medical professionals and other health workers, that they are raising their voice, and they're trying to be heard. And of course, ideally, or hopefully, they should be heard during COP26 and from then on. Marcela, so you were mentioning about that during COVID times as well. I mean, water's connection with its communities is so strong. I've seen it firsthand. And you have people working on the ground, and it's a very strong network and good, strong community support. How has COVID in any way now somehow informed the way water thinks about its projects and about health?
Uh, well, I have to say that it was inclusive of this component that we realized we had to focus more on an ecosystem based approach to find our responses. And from the other perspective, that was one. And the other aspect is uh, no one agency can do it alone. We are very clear of it. We have realized that no matter what one agency does, that means it could be the NGO sector, or it could be corporates, or it could be government. If each one works in their own silos, we will not achieve the goal. We have to bring in the strengths of one another. We have been trying to do this in a way, even at the local levels, where we get the communities to interact with one another, across landscapes. So bringing various villages right across, even in at a block level or a district level, to interact with one another, together with the local government authorities and the other workers and the other NGOs. Because unless we do it together, we will not take it forward. And that's what we realize again and again, that we just have to pool in resources. Each different agency has its own strength. No one can cover up what the other is doing. And in this time of urgency, and I'm saying urgency because we have a very little time before we, it's not just meeting the UN agenda, it is meeting our survival needs, that we have to work together. And unless all of us talk the same language, it won't happen. But it is a slow process. It is very
Yes,
slow. Because when
definitely.
I look at rural communities, if we talk and ask them, you go and conserve the ecology, you plant more trees. If they don't see income coming in, how will they feed themselves? How will they take care of the future of their children? It's not just protection versus income, it's survival for them. It's for the rest of us who have to think what we need to do to make it happen. You know, and
Yes,
we
definitely.
do bring, I just have to say here one more point. When we have been having even workshops, and I'm talking about workshops where we are discussing issues with rural communities, at that time we bring in the local government officials, even at the district level, because they need
Okay.
to hear what's happening with the communities. We need all to talk as citizens coming from different roles we play. I think we need to work a lot more together and for our own survival.
Definitely. Thanks so much for those very insightful reflections from your own personal field experiences, and I think these are definitely important points that we need to keep in mind. Let me just tell our audience that if you have any questions, you could please post them as comments, and we could try to take them up as soon as we have finished the main discussion, which is almost coming to an end. So you can definitely, you're encouraged to leave your comments and questions. So, based on all you have said now, and having known both of you for several years now, one of the things that inspires me always, thinking about you or engaging with you, is that you are both very motivated, and in the context of young people who are concerned about this issue, feel helpless. What is it that we talk about the issues of power and the issues of power differentials, and these are huge challenges that are seemingly insurmountable challenges that we are faced with. What is it that keeps you motivated, and what is it that keeps you going? Maybe I will ask Marcela first.
Well, I only have to say, uh, each one must listen. One must listen to what the deep within talks. That's a connect, I could say. And I say deep within, I'm not talking about any inverted commas spirituality. It's, what do you feel passionate about? And I think if, talking about youngsters, I look at the team of youngsters I have over here. We take them to a process to find out what is it that you are passionate about. Forget about the organization, forget about doing anything else for anybody else, forget about the job. I said jobs are secure, you don't have to worry. But what are you passionate about that you want to make a difference with? I think it begins there. Rather, if we are just caught up in listening to a lot of things, I think that what one is passionate about is always far deeper than what we realize. And
Thank
everyone
you.
has.
Thanks so much, Masala. That's very nice that the young colleagues have a person like you to work with, I think. Shweta?
I just like just to simply put this, I don't think we have a choice. And I mean, we can't afford to get, I mean, it is overwhelming, and I think it's important to recognize that. It feels, it is a big task. It requires, it can't be done alone, but we all have to contribute our bit. We cannot afford to become cynical. We can't give up. I don't think that
Yeah,
would be a right thing. And at the end of the day, whatever happens, I think personally, I want to be on the right side of history by doing what I can do. So, it's a little bit of a that also, but and one way to sort of uh, uh, remain positive. I'm not saying hopeful, because that is a very different context. But just to do our bit is to do it together. We can't do it alone. We have to rely on each other's strength. We have to rely on our community that is there. And for me, and I think all of us at some level have experienced this during the lockdowns, during the restrictions, and when we were all sort of, it was overwhelming. Is that what what will pull us together is our collective resilience.
yeah.
So it's even more important that we are together in this till the end, whatever that end is. I mean, it's very hard to predict things like that, but we just need to do what we are doing, and do it well, and do it together.
Thank you. This was, I think, a very interesting and enlightening discussion on climate change and health practice in India. Uh, and I think with your concluding remarks, you have also shown us that what is it that we need to do to uh, as we move forward. As we move forward, is there something you want to add in the context of how do we move forward from here? Uh, just in connection with what you just said, Shweta and Marcela. Shweta first.
See, I think, I mean, not that I'm a climate and health campaigner, but I just feel that all of us see the importance of health. And my request to everybody is sort of like to look for health, underlying health policies, or policies that have to incorporate health impacts, environmental and human. And if it is not there, then make an effort to bring that into the conversation, into our interventions that we make. I think we have to keep health at the center of all conversations, because at the end of the day, that's what matters. Our health, our children's health. So it's sort of like, I would say, very purposefully look for those connections and bring them into our conversations wherever we are, at whatever level we are. It's important to do that. And resilience matters. And yeah, it is important to sort of work towards, or incorporate working towards resilience, climate resilience, in our programs and in our interventions.
Thank you. Thanks so much, Shweta. Marcela.
Yes, I would also say, as we look forward, if we keep, I'm talking about it a little selfishly, but if each one says, I need to take care of my health, my children's health, my children's children's health and future, then we realize we have to take care of a lot more of one another, because only then we can go forward. And I think in this sense, being in that way, inverted commas, selfish, will actually get things too if we make the change in our own lives then, you know, and we need to
Thank
work
you.
together. Yeah. Thank you.
Yes. I think wise words from both Shweta and Marcela to conclude this very interesting session. Thank you both for taking this time from your busy schedule to join us for this panel discussion. I'm sure even in the months to come, as this video is available online, many students will benefit from listening to this when they think about climate change and health in India. And this also provides some sort of a timestamp for us to see what it was, what was our conversation like in the year 2021, 21st October, when we were talking about climate change and health, when we look back. So thank you both very much for joining us, and I hope to be in touch with you for these conversations in future as well. Thank you very much.
Thank you so much.
Thank you for inviting us to share our experiences. Thank you.
Thank you,
Yes, thank
everyone.
you, Aditya, and thank you,
And
Marcella.
yeah,